My name is David. I'm a patient of Mr. Dimitri's. I was recommended to Mr. Dimitri by a GP friend of mine to have a look at a problem that I had on my right knee, which I assumed was a small varicose vein. It turned out to be an AVM, which is, I'm told, is an arterial vein malfunction. I had this problem for about 10 years or more, and I'd been to see a consultant previously, and they informed me that they didn't think it was worth doing and I shouldn't really mess with it and leave well alone. But over the years the pain had got such that I had to go and have something done about it. It was starting to bother me in the day-to-day life. I'm keen on sport, found that I couldn't do the sports that I was doing before. I'm a keen skier, and I got to the point where I was afraid to fall over on the skis in case it bumped this little lump that was on my leg. So I went to see Mr. Dimitri, and he looked at it and confirmed to me that it really did need to be dealt with, as it was at a stage where it could actually burst and cause me to bleed considerably and give me a fairly unpleasant experience. So with that, we agreed to go in and have the operation. I was booked in. I went into the hospital on the morning of the operation. I had the operation in the morning at about 11 o'clock, and by 1 o'clock I was sitting up pretty well ready to go. I was still coming out of the anaesthetic, but I wasn't experiencing anything in terms of discomfort. By mid-afternoon I was on my way home with a bag of painkillers and some instructions from Mr. Dimitri. The scar was, I could see it, from when I got home, to have a little look to see what was happening. It was very neat and wasn't giving me any discomfort at all, which surprised me. I think that was the thing that surprised me most of all, that there was, from having the operation come out of the hospital, I didn't feel any pain at all really, apart from it felt like a little paper cut. So I went to bed, had a pretty decent night's sleep, woke up the next day. Again, apart from a little bit of discomfort, I didn't really have any pain to talk of, and decided that I was fairly well done with the painkillers. After the operation, didn't need them again. I went to have my stitches taken out 2 weeks later, and then an appointment with Mr. Dimitri, I think after 6 weeks. He was very pleased with the operation. The scar by this point was barely visible. It had dried up and healed up pretty well. And I was starting to feel very strong again in my leg, and started to resume my sports, one of which is cycling. I'm a keen road cyclist. And I noticed pretty well straight away when I was getting out on the bike that there was a marked improvement in that. I'd got so used to the discomfort and managing, not banging it because it gave me so much pain, that it made a big difference to the overall ride for me. And very quickly, started to improve each day in terms of the scar disappearing, and also from a point of view that there was no pain at all. So we monitored that for a few weeks, and about 10 or 12 weeks in, I did an 80-mile endurance ride and had absolutely no problems at all. And I'm now a good 6 or 7 months into since I've had the operation, and I've had relatively no discomfort, the occasional twinge from it, but nothing in any way concerning, and it feels 100% better. My experience now of doing the things that I used to do is back to where it should be. So personally, the whole experience for me, from the professionalism of Mr. Dimitri and the team that he picked to do the job, and my benefits afterwards, I have no hesitation in recommending Mr. Dimitri for similar procedures.